I suppose my interest in psychiatry was seeded with a very inspirational psychiatrist that showed me that mental health problems can be really quite mysterious, really quite different. And it was from that point onwards, I think, that I always thought about applying for psychiatry.
The reason I came into psychiatry is because I'm really interested in people. I always have been. I love watching reality telly. I love thinking about what makes people tick. And psychiatry uniquely, I think, gives you the time to spend with people.
I think psychiatry is a career that allows you to diversify and to influence policy. So there's a lot of information in the news, in the media about psychiatry and the stigma, and I think your ability as a psychiatrist to work with that, to work in hospitals, to work in the local community, to work with patients and carers to try and break down that stigma for me is a really rewarding part of the job.
My work is very rewarding. I work with children and adolescents under the age of 18 who present to our services with mental health difficulties, starting from in early childhood, feeding problems, any other difficulties with their temperament, with their sleep, to older children with depression, anxiety problems, ADHD, and autism.
The freedom within the training programme for psychiatry is great. I don't think there are any others that allow you this special interest time to go out and pursue your own area of interest related to psychiatry. I think that's really special. For example, I have an interest in music therapy, and I intend to spend some of my time looking at the use of music therapy for old people with dementia.
My role in one word would be varied.
Stimulating.
Caring.
I think that would be unique, but also as a psychiatrist, it's really important that you appreciate that the people you treat, your patients, they are all unique individuals as well. And although you might diagnose many people over your career with depression, it's unlikely you will ever see two people with depression present in the same way with the same symptoms.
I would certainly encourage someone who's interested in working in psychiatry to get some experience, contact their local unit, to go down there. Certainly to become a psychiatrist you need to complete your medical degree, so you would need to find out information about medical school and then what application process you would need to go through to apply to medical school.
The huge advantage of general adult psychiatry, though, is that it gives you a very broad range of skills, experience and knowledge, which then allows you to choose certain subspecialities like eating disorder psychiatry, but also substance misuse psychiatry, rehabilitation psychiatry.
There is a very good work-life balance that you have got, you see psychiatry patients, but also you do not feel that you are overworked. You have still got time for yourself, for your family, for your leisure. So it gives a very good work-life balance.
For me, it's all about working with patients, and sometimes when you go and assess somebody and you tell them that you think they've got a treatable mental illness, the relief that you see in their face and the relief that you see in their loved one's face when you explain there is a treatment for this, we can help, that is a wonderful feeling, and that's one of the reasons that I'm a psychiatrist and proud to be one.